In today's video, I'm going to go over suprapatellar bursitis. Now, what is suprapatellar bursitis? That is inflammation of the bursa sac just above the kneecap in the patellar, or just above and behind that quadricep tendon. Sometimes it's called quadriceps bursitis. So I'm going to show you 6 tips that we're going to go through to try to reduce your pain, improve your range of motion, and enhance your function. So the first movement we're going to do is called a quad sits. What I'm going to do, I'm just going to have my knee out as flat as I can get it here, and I'm going to tighten up my thigh, working on pushing the back of my knee down into that mat as hard as I can. You know, initially you may not be able to push down that hard, but you're going to work on trying to push down progressively harder. Sometimes I'll have patients roll up a towel roll or a small bolster, put behind their knee so they can push against that, and you're going to work on trying to hold that for maybe 2 to 5 seconds for 2 to 3 sets, 10 to 15 repetitions, 1 time a day. The next exercise I'm going to do is a straight leg raise. So what I'm working on is really tighten up my thigh. I'm going to feel this in my hip. I'm going to bring my leg straight up so that my heel comes off the mat there, or the bed, or whatever surface that you're on. And I'm going to hold this somewhere between 3 to maybe 10 seconds and back down. Now, if you're not able to hold that with each repetition, you can just perform it with repetitions and then work on being able to hold it. And I complete somewhere between 2 to 3 sets, 10 to 12 repetitions, 1 time a day. Now we're going to complete wall sits. And so what I'm going to do, and I've done this in videos before, just lean against the wall. I'll put my feet, 5, 10, 12 inches away from the wall. Obviously, the farther away from the wall your feet are, the harder this is going to be. And I'm just going to kind of come down here a little bit. Initially, I would do just like a high wall sit, so just in this position. Maybe I'll hold it for 10 to 15 seconds. It just depends on how much pain you have going on as to how long you can hold it and how far down you can go. I do caution you not to go really deep in here too much, because that could irritate the bursa sac a little bit. It may not, but I have had patients go too far, too soon, and that's irritated that. You can then progress that to a wall squat, so just back against the wall. You can put a towel against the wall. You can use one of those exercise balls against the wall if you want to. And I'm just going to squat down and then come right back up. Squat down and then come right back up. Again, focusing on tightening up that thigh, that quad, and also focused on my control of my knee while I'm doing that movement. And I would complete 2 to 3 sets for 10 to 12 repetitions, 1 time a day. Now this exercise I call step outs. So what I'm going to do, we're going to say that it's my left knee that has the inflamed bursa here. And I can hold onto a surface if I need to, the back of a couch or a chair, countertop. But if not, if you don't need that, you're just going to go like this, straighten out your knee, tighten up your thigh, and then I'm going to kind of step out to the side with my toe and then come right back. Step out to the side with my toe and come right back. Now, to progress that and make that a little harder, I'm going to bend my knee a little bit, just a little bend in the knee, and then I'm going to step out and then come back. Step out and come back. So initially start with your knee locked out, nice and straight, and then you can progress to bending the knee. And I would complete somewhere between 2 to 3 sets of 10 to 12 repetitions, 1 time a day. Now we're going to add in a quad stretch to this, or a stretch to the thigh. So you can start off in a sitting position. So let's just say that I'm sitting. I'm not in a chair now. We're going to say that I'm sitting, and I'm going to pull my knee back just like this. I'm going to stretch the quad here. Now you're going to hold that for 10 to 20 seconds and repeat that 2 or 3 times. As you become more comfortable with that and it's not as painful, then what you want to do, you can go in a standing position, bend the knee back, and then pull the foot up like this. Now that is a more aggressive stretch, and of course you want to make sure that you're holding on. You don't want to fall when you do that. And the thing to remember with this stretch is a little bit of stretch, slowly progressing with that force would be better than just going in straight aggressive and just pulling as hard as you can. I like to be easy with that and slowly go into that stretch. Now the last thing that we're going to do is use one of these Fascial Rollers or muscle rollers, and I'm just going to go on the thigh. I'm going to stay off of that bursa where it's really inflamed. I'm just going to take this and just work back and forth. Doesn't have to be really aggressive, just nice and slow back and forth over the muscle to try to reduce some of that tone, and just to kind of make it feel a little better, improve that cortical mapping, that with the homunculus, that cortical smudging that happens when you have an inflamed area. So whatever the term or the purpose that you're using for it, to be honest with you, I think it just feels good on the quad just to be able to roll that out, especially if this area has been tight and sensitive. So anyway, that is using a Fascial Roller. Thanks so much for watching, guys. I hope this video helps to try to reduce your symptoms from suprapatellar bursitis. Thanks for watching.